Hey everyone, this is Dr. Sean Wu. I'm a board-certified dermatologist practicing in Hunt Valley, Maryland, just north of Baltimore. I'm starting this YouTube channel, The Derm Guide, as a way of answering commonly asked questions in dermatology. Now, without any further ado, let's get into our first topic. Now, if you've been to the dermatologist recently with an itchy rash, there's a pretty good chance you were given a topical steroid. This is a super important class of medicine in dermatology. Topical steroids calm inflammation on the skin without causing too many internal side effects. However, if used incorrectly, topical steroids can do irreversible damage to the skin. There are many formulations of topical steroids. It is absolutely crucial that you know how to use yours correctly. Corticosteroids are naturally produced by our adrenal glands, which sit on top of the kidneys. The most important naturally occurring corticosteroid is cortisol. Cortisol, when synthesized in a lab and given as a medication, is known as hydrocortisone. Corticosteroids have many effects all over our body. However, they're most useful to doctors as a tool to fight overactive inflammation. Steroids can enter any cell in our immune system and turn down their activity. Hence, corticosteroids are broadly anti-inflammatory and immunosuppressive. In the skin, corticosteroids also thins out the skin by turning down the activities of cells that regenerate the skin, notably keratinocytes in the epidermis and fibroblasts in the dermis. Topical steroids are divided into 7 groups based on their strength and potency, with Group 1 being the strongest and Group 7 being the weakest. It would be impossible to cover every single topical formulation available. My goal is to cover a few that I use on a regular basis. Hydrocortisone and desonide are commonly used weak topical steroids. Generally, they can be used anywhere on the skin, but often they are used to treat rashes on the face and skin folds, such as the armpit and groin. Triamcinolone acetonide is a medium-strength topical steroid. It is a bread and butter anti-inflammatory treatment for most dermatologists. It comes in all sizes, from tiny tubes to pound-sized jars. The large-sized pound-sized jars are particularly useful for rashes that are widespread on the skin. Clobetasol and fluocinolone are some of the strongest topical steroids available. In general, these are most useful in severe disease with thickened skin, such as in psoriasis or chronic eczema, or in areas where skin is naturally thicker, such as on the palms, soles, and scalp. These strong topical steroids should ideally only be used for 2 to 3 weeks at a time. They should almost never be used on the skin folds or face, and never be applied to a large area at a time. So that's it for my summary of steroid potency. If your topical steroid isn't on this list, there are many good steroid potency charts that can be found online. See the link down below to one that I really like. The key is to know how strong your topical steroid is and how to use it appropriately. Next, we will talk about something that is just as important as choosing the right topical steroid strength. We're not talking about cars here. Vehicles in derm world refers to the base that a topical drug is delivered in. Examples of vehicles include ointments, creams, lotions, gels, solutions, and foams. Ointments and creams are a mixture of water and oil. Ointments are the most oil-heavy vehicle. That also makes them the most moisturizing and the most effective in delivering the steroid particles into the skin. However, ointments are also fairly greasy, hard to spread, and may get onto the patient's clothing and sheets. Using ointments in the moist areas may also cause hair follicle plugging and folliculitis. Creams are also fairly moisturizing and effective at getting corticosteroids into the skin. They are also more cosmetically elegant and easier to apply than ointments. They offer a nice balance between efficacy and feel. Gels and lotions are primarily water-based and may include some alcohol. They are easier to spread into the skin than creams and ointments, but patients with sensitive skin may complain of burning sensation by the alcohol component. Solutions and foams are water-based. They are not moisturizing and are less efficient at delivering the steroid molecules into the skin than ointments and creams. However, they are especially useful for hair-bearing areas such as the scalp due to the ease of application. Like gels and lotions, patients with sensitive skin may complain of a burning sensation with solutions and foams. Topical steroids are usually applied either once daily or twice daily. To figure out how much to apply with each application, we first need to figure out how much of your body surface area, or BSA, is affected by your rash. The best way to estimate this is by using your palm as a rough estimate for 1% of your entire body surface area, or 1% BSA. These are some rough estimates for how much body surface area certain anatomic parts take up. For example, the face and neck together make up around 5% of an average adult skin surface. You can pause the video to take a closer look at all the numbers. Next, we need to learn about fingertip units, or FTUs. 1 FTU is the amount of cream or ointment that can be squeezed from a tube with a typical 5 mm nozzle covering from the fingertip to the distal finger crease. The key relationship between FTU and BSA is that for most adults, 1 fingertip unit will cover around 2% of BSA. Taking this relationship into account, here are some rough estimates for how much cream or ointment is required to cover certain body areas. See that to cover the face and neck, which covers around 5% of body surface area, we need to use 2.5 FTUs of cream with each application. Overall, topical steroids are safe to use. There are millions of patients every year who benefit from the use of a topical steroid for their inflammatory skin condition. However, there are definitely some side effects to watch out for while on this medication. The most common side effect of topical steroids is skin atrophy. This can show up as a shiny, wrinkly appearance of skin, as seen in this patient. Stretch marks are another sign of atrophied skin and are notoriously difficult to treat. Skin thinning can also result in prominent spider veins and makes veins more vulnerable to light trauma, as in this case of easy bruising. Topical steroids can also cause an acne-like rash on the face, upper chest, and back. When this occurs around the mouth, it is typically called perioral dermatitis. These rashes usually improve gradually upon discontinuation of the topical steroid. Hypopigmentation or skin lightening can also occur with topical steroids, especially with darker skin types. Contact allergy can also rarely occur for any topical steroid. Patch testing, as seen here, can be performed in office to determine the specific allergen. If a steroid is a source of the contact allergy, your doctor may be able to find an alternative steroid that has a low chance of causing a cross-reaction. Steroid withdrawal syndrome is a phenomenon of rebound inflammation that can occur days to weeks after stopping a prolonged topical steroid course. Symptoms may include redness, scaling, itching, burning, and stinging. Finally, suppression of internal production of cortisol can also rarely occur. Risk factors include the use of strong topical steroids, chronic use in large areas, and young age. Since cortisol has wide-ranging effects throughout our body, our bone health, metabolism, and internal organs can all be affected. Although topical steroids are very effective in the short term, their long-term use can lead to more side effects. Typically, topical steroids should not be used for more than 4 weeks in a row to any area. If you find that you need to use your topical steroid for more than 4 weeks, you may want to consider adding a non-steroidal anti-inflammatory cream to your regimen. I often see patients come to me while using a combo cream with an antifungal and a topical steroid. This particular combo with clotrimazole and betamethasone is very popular. The issue with this combination is that betamethasone dipropionate is a very strong topical steroid that should almost never be used for the skin folds. While clotrimazole is safe for the groin, using betamethasone for any extended amount of time can cause irreversible stretch marks in this area. For this reason, I almost never prescribe this combination for my patients. And that's a wrap for topical steroids. If you like this video and would like to see more like it, please like or subscribe. Comment down below if you have any questions you would like for me to address in a future video. See y'all next time!